This video is made with the intention of guiding the friend or a relative of a newly diagnosed cancer patient. Cancer, the word itself can give tremors to you. Just imagine what happens to a cancer patient when he or she is newly diagnosed with cancer. It basically runs a set of emotions which are difficult to describe. As a treating oncologist for nearly a decade, I have seen the emotional, psychological stresses that not only the cancer patient goes through, but also the relatives and friends of a cancer patient. So, what to do if your friend or your relative is newly diagnosed to have cancer? The first thing to do is to visit a center which offers advanced cancer therapeutic. Remember, cancer is best treated the first time. There may be rarely second chances to cure cancer. So it is very important to make sure that you take the best treatment the first time. What better when treatment is taken at a reputed or a cancer center which has all the specialities under a single roof. The next thing to avoid is to not do a lot of Google searching and not to take multiple opinions. Remember one thing, the basics of cancer treatment are known to all oncologists. Any oncologist who's working at a good cancer center will be able to guide you as to what best needs to be done after diagnosis. Make sure you follow the advice of one oncologist or one oncology team so that you do not waste time in starting treatment for cancer. I have seen many a times that a patient would have been diagnosed around 3 to 4 months ago, would have done all the tests that time, would be taking multiple opinions, and finally when I see him or her in my office, the patient's cancer would have progressed. Now, that is unfortunate according to me, because if the same patient was treated at that time, the cancer would have been curable. So, make sure that you do a thorough, quick research of the nearest and the most reputed cancer center and take the best treatment at the earliest. Make sure to be positive around the cancer patient. We all would definitely know that the cancer patient would be distressed. There must be a lot of things going through their minds. Make sure to be positive around them. Do not show stress in front of them, because when you show stress to them, they get more stressed. Try and make sure that you encounter the problem in hand rather than dreading the problem. Make sure to just start the treatment. Take all the best decisions possible at the earliest time, start the treatment, and be with the patient at all times. Support the patient, especially when the patient is feeling some effects of treatment. Could be tiredness, could be a little bit of pain, could be emotional disturbances, lack of sleep, indigestion, and so on. Make sure to be a bridge to the patient so that whatever patient wants to know about his or her cancer treatment can be conveyed to the treating doctor, and all the opinions and all the advices given by the doctor is implemented. Sometimes the cancer patient may not be motivated. So it helps that your closest friend or relative can help the patient to deal with all the day-to-day activities. Make sure that all the reports are kept safely. Make sure that the diet advice is followed. Make sure the patient follows all the instructions such as exercising. Make sure a positive environment is laid around the patient so that patient does not get distressed. Make sure that the patient follows up on time. And even after the completion of therapy, make sure the patient follows up so that the regular checkups can be done without losing time.